There are many things that can go wrong with the voice. Now, most vocal issues develop over an extended period of time. Nodules, for example, may take months to fully develop. There is one vocal pathology, however, that can develop in an instant: vocal fold hemorrhage. What is a vocal fold hemorrhage, and what can you do if you have received this distressing diagnosis? I've got some helpful thoughts coming right up.
Sound check. Check 1, check 2.
G'day everyone, and welcome back to Voice Essentials. It's so good to see you again. If you're new to my channel, hi, my name is Dr. Dan and I'm a contemporary singing voice specialist. It's my job to help you realise the full potential of your singing voice. Now, it's also my job to assist in the rehabilitation of sick and damaged voices. As I stated at the start, many things can go wrong with your vocal apparatus. Some voice disorders, such as vocal fold hemorrhage, can strike any singer at any time. Voice damage, what many modern voice care professionals prefer to call vocal disturbance, is not always due to self-imposed vocal abuse. So if you've recently received a diagnosis of vocal fold hemorrhage, I hope the next few moments will prove informative and reassuring. If you're a regular to my channel, you'll notice that this is a re-edit of a video some weeks back. The previous video prompted some updates to my knowledge from respected colleagues, and so I thought it prudent to update the information. Thus, you're now watching the new and improved version. And a quick qualifying statement as we proceed: I am not a medical doctor. My doctorate of musical arts is in the area of learning and teaching. So it's important for me to state from the outset that any diagnosis of voice disorders should only be performed by a registered ear, nose and throat doctor, preferably a laryngologist who specialises in the care of the human voice. The information that I'm about to provide is purposefully general in nature and is designed to encourage you towards better vocal health. I think when most singers think about vocal injuries, nodules immediately come to mind. Now, nodules, what some people might call nodes, are serious, but as I said before, they typically develop over an extended period of time. A vocal fold hemorrhage, however, is different. Perhaps one of the more debilitating functional disorders of the voice in the acute stage, the Dictionary for the Modern Singer explains that a vocal fold hemorrhage is a type of voice disorder that occurs when a blood vessel ruptures within the vocal folds. Vocal fold hemorrhages are generally caused by trauma or abuse. After a hemorrhage, the voice will quickly become impaired due to blood accumulation in the vocal fold, which prevents normal mucosal wave formation. This seems to have been the case for Adele. In her 2015 interview with 60 Minutes, Adele described the sensation of her vocal fold hemorrhage as literally like someone switched a click off in my throat, like someone put a curtain over my throat. A vocal fold hemorrhage is the rupture of capillaries either within the lamina propria, that is the middle layer, or the epithelium, the outer layer, causing bruising of the vocal fold. As we observe in this footage, the bleeding impedes normal vocal fold oscillation and, if left untreated, can lead to significant scarring.
Sound check.
As you can see, a vocal fold hemorrhage is a pretty serious matter. So, how do vocal fold hemorrhages occur? Good question. A vocal fold hemorrhage can happen due to sustained extreme voice use, and it can also happen in an instant when the voice is vulnerable during times of sickness, menstruation, or from a simple stifled sneeze, for example. Again, the severity of the vocal fold hemorrhage is determined by the depth of the bleed out. Superficial bruising of the outer layer of the vocal fold will frequently leave the oscillation of the vocal fold unhindered. This kind of light bruising will often self-resolve with extended vocal rest of a few weeks or so. If, however, the bruising extends deeper into the middle layer of the vocal fold, then the singer will almost certainly experience a disruption to their ability to create vocal sounds. Leda Skurs, a leading singing voice specialist, explains rupture of a deeper capillary with extravasation of blood into the vocal fold leads to stiffness of the vocal fold and potentially an altered contour to the medial surface called a hemorrhagic polyp. It's important to also note that a vocal fold hemorrhage can at times also be non-symptomatic. That is, a singer can experience a hemorrhage in the superior surface of the vocal fold that is away from the leading edge of the fold, and this means their voice may not experience any noticeable disruption. Regardless of depth, a vocal fold hemorrhage, unlike nodules for instance, where continued voice use with altered phonatory patterns may prove beneficial, the singer who experiences a vocal fold hemorrhage will almost certainly need to observe a period of absolute voice rest in accordance with the directive care of a laryngologist and a speech pathologist. You see, unlike nodules, continued voice use may heighten the risk of rebleed. Just like any other significant bruise on your body, a vocal fold hemorrhage needs time to resolve and heal. I've got a few tips on how to care for your voice, both when seeking to avoid a vocal fold hemorrhage and when needing to care for the voice after a diagnosis of vocal fold hemorrhage. But before I list them off for you, please take a moment to hit the thumbs up button if you're enjoying today's video and it's proving helpful.
Sound check.
Rest assured, a vocal fold hemorrhage does not and should not spell the end of your singing career, professionally or otherwise. But as is often the case, prevention, where possible, is better than cure. So what can we do to lessen the risk of this challenging form of voice disturbance? Well, firstly, consider the way you're using your voice. Sustained extreme vocal practices such as power ballads, which use belt, and genres that employ distorted voice like metal and screamo, are best performed by singers who have established a solid foundation of task-specific technique. Just stepping onto the stage and screaming your head off for extended periods of time without any technical foundation places your voice at higher levels of risk. Singing when you're sick is also ill-advised because when you have a cold or flu, your vocal folds are likely to be already swollen, either due to direct infection or an accompanying cough. When we choose to sing on already swollen vocal folds, we risk further exacerbating the swelling, which in turn heightens the risk of vocal fold hemorrhage. Ladies, you have the added challenge of your menstrual cycle to contend with. Hormonal fluctuations may lead to swelling of the vocal folds, and as respected laryngologist Dr. Robert Sadeloff explains, submucosal hemorrhages in the larynx are more common in the premenstrual period. Premenstrual voice syndrome is a very real thing for about 1/3 of women, so ladies, pay particular attention to the care of your voice in the days leading up to and including menses. And of course, if you believe your voice is not recovering like you know it would normally directly following your period, then seek medical advice as soon as possible. And here's an interesting one. Always try to avoid stifling your sneezes. When we stifle a sneeze, we place tremendous pressure back against the vocal folds. A single stifled sneeze can burst many capillaries within the vocal folds, so always let your sneeze occur in an unrestricted way. Also, unrelenting cough can prove to be traumatic for the vocal folds, so if you have a consistent cough, please see your doctor who should be able to help you resolve the cough's trigger. Finally, do your best to avoid singing with blood-thinning agents in your system. Drugs such as aspirin and ibuprofen should be avoided when placing the voice under extreme loads for extended periods of time. And if you have experienced a vocal fold hemorrhage, then Leader Skirth suggests supplements with garlic, ginkgo, ginseng, ginger, or fish oil can affect coagulation and should be stopped. Allow me to once again reassure you, especially if you currently suspect you've had a vocal fold hemorrhage, that not all is lost. I strongly recommend seeing a laryngologist for a full assessment of your current vocal condition. Left unattended, a vocal fold hemorrhage can become a bigger problem, but if you respond immediately with voice rest and good voice therapy, then your singing future remains bright. Remember the footage I showed you earlier displaying a vocal fold hemorrhage? Here's the same voice 1 week later after the hemorrhage has resolved with medical intervention including assessment, diagnosis and rest. The voice can recover after a vocal fold hemorrhage with the right diagnosis followed by the right care and attention. Again, do everything you can to avoid developing a vocal fold hemorrhage, but if Like Adele, you feel a sudden click or change in your throat and sound, or even if you don't necessarily feel anything significant but you suspect your voice is not performing like it should, stop singing immediately and seek a full vocal assessment from a laryngologist at the first available opportunity. As always, I hope today's video has been educational. Leave me any comments below outlining your personal experiences and further questions you might have when it comes to vocal fold hemorrhages. And before I go, if you're new to my videos, then please take a moment to check out my channel for more videos designed to develop your voice and improve your sound. Voice Essentials is a global community of singers who encourage each other in the development of their singing. We hope you'll join us. I'll see you again soon. I'm Dr. Dan. Sing well.